Welcome, everybody. Today, we're going to explore what it means to counsel transgender and gender diverse youth living in conservative or rural Michigan communities. This workshop focuses on practical tools, ethical grounding, and culturally responsive strategies that counselors can use when working with young people whose identities place them at the center of social, geographical, and relational tension. Introduction to the population. Transgender and gender diverse youth in rural Michigan sit at one of the most vulnerable intersections of identity and geography. In small towns where tradition and religious norms shape daily life, authenticity often comes with a social cost. Isolation, community stigma, and limited access to affirming care mean that identity development is less of a natural process of adolescence and more of a survival task. National research from groups like the Trevor Project shows that LGBTQ plus youth in rural areas face higher rates of harassment, depression, and suicidal ideation than peers in urban settings. As counselors, we're not just treating the symptoms, we are stepping into roles of safety, advocacy, and ethical leadership. Why this issue matters. Rural realities on the ground. In many rural towns, visibility has grown faster than acceptance. Youth often rely on grassroots networks, small advocacy groups, or even informal community allies to feel seen. Schools may refuse affirmed names or pronouns. Districts may cite parental rights to block bathroom access. And faith communities may still frame gender diversity as moral rebellion or sin against God. These patterns create predictable outcomes: couch surfing, running away, or survival housing. And research consistently shows that family rejection increases suicide attempt risk more than eightfold. Wow. This is why even one safe adult, often the counselor, can reduce that risk by nearly 40%. The balancing act in rural counseling. But working affirmatively in conservative regions requires a careful balance. Our goal isn't confrontation, it's collaboration. We can partner with supportive clergy, trauma-informed educators, and community leaders who value youth safety even when they struggle with identity politics. Access barriers remain real. Transportation, provider shortages, privacy issues, and limited broadband can all restrict how youth reach care. That means we must innovate using discrete check-ins, school partnerships, and hybrid telehealth options to preserve confidentiality and trust. This population matters because it reveals the heart of counseling, meeting clients where they are, and rebuilding dignity in the places where it's most fragile. Assessment and diagnosis pitfalls. Assessment and diagnosis are not neutral acts. They're shaped by culture, worldview, and community narratives. For transgender youth in rural Michigan, entering counseling can feel like entering a test. Not, are you struggling, but are you acceptable? Our job is to remove that fear and replace it with safety. Access barriers, the invisible gatekeepers. Rural infrastructure creates invisible gatekeepers. There are fewer licensed counselors, fewer transportation options, and fewer places where a teenager can privately ask for help. Yes, telehealth helps until the youth realizes that their parents can overhear the session or check their search history. The counselor must adapt, offering flexible scheduling, phone-based sessions, school resource room appointments, and multiple modes of communication. Early safety and privacy conversations become essential. Affirming care in conservative contexts, the bias beneath the question. Bias often hides in our language. Questions like, when did you decide to be transgender? Can instantly shame a youth, even when asked innocently. Language really matters, especially with this population. Rural clinicians Rural clinicians may also feel pressure from community norms that frame gender diversity as confusion or sin. This can lead to misdiagnosis and harm. Balancing affirmation with cultural respect is one of the biggest challenges. You are not trying to win an argument, you're trying to build a bridge. When a parent says, I just want my son back, we can hear the fear instead of the hostility. Reframing through values like protection, connection, and love helps preserve rapport while opening new pathways to education. Knowing the limits. Advocacy must be paced. If you push too hard in a resistant community, you may close doors for every trans youth who comes after. Pace really matters. Consider this case fragment. Jordan, a 15-year-old transgender boy, referred to counseling after repeated bullying. His parents want to fix the confusion, and the clinic waiting room is full of familiar faces from church and school. How we begin truly matters. Instead of asking, why do you think you're transgender? We might ask, what helps you feel most like yourself? And what gets in the way? This single question reframes the entire relationship from the start. Key takeaways. In rural counseling, assessment must be culturally attuned and grounded in humility. 3 truths guide us. The first one, affirmation reduces harm. The second, bias correction is ongoing self-work. And the third one, compassion framed in community language can be revolutionary. Let's move now into intervention strategies that honor both culture and identity. Intervention strategies. Intervention with transgender youth in rural Michigan requires creativity within constraint. The question isn't, what does best practice look like in theory? The real question is, what version of best practice will survive and thrive here? Three frameworks anchor our work: ethical grounding, upholding autonomy and resisting value imposition; trauma-informed care, assuming trauma until proven otherwise, and centering empowerment; affirming practice, treating pronouns, names, and identity expression as therapeutic necessity, not politics. Within these frameworks, the counselor shifts from expert to ally. For many trans youth, the counseling office is the only place where they can use their name, wear affirming clothing, or speak openly about themselves. This is the only place where they can be themselves without putting on a fake persona for a lot of people. The safe room model rests on 4 pillars. The first is affirming environment, visual cues of safety. The second, narrative regulation, using rural metaphors to reframe struggle. The third, skill integration, blending CBT, mindfulness, and ACT. The fourth being safety planning, crisis scripts, code words, and lifelines. As one Michigan clinician put it, counseling here is triage and theology at once. You keep them alive, and you keep their hope believable. When family improvement is possible, the counselor becomes a translator between worlds. We reframe through shared values: protection, love, and stewardship. We introduce pronouns slowly. We connect parents to local peer groups so that validation comes from neighbors, not strangers. Neutrality becomes credibility. In small towns, being seen as reasonable opens doors that activism alone cannot. Schools are often the only public institution a young person enters daily. But policy battles over bathrooms and pronouns can silence even supportive staff. Counselors support educators quietly through consultation, trauma-informed language, and crisis response planning. When formal systems fail, micro-allies, like librarians, nurses, bus drivers, become the real safety net. Hybrid solutions. Hybrid care expands access, but introduces new vulnerabilities: shared devices, surveillance, broadband gaps, lots of them. Michigan programs like the Telebehavioral Health Initiative have shown that combining virtual care with occasional in-person sessions boosts engagement by 35%. Hybrid isn't a compromise, it's innovation. It's innovation. In conservative regions, advocacy works best when it looks like service, not conflict. Workshops framed around youth stress and resilience, or partnerships with moderate clergy, quietly shift community understanding without triggering resistance. Ethical advocacy means translating justice into the local dialect. Evidence-based doesn't mean emotionless. In rural counseling, healing emerges from relationships, not manuals. Affirming CBT, narrative therapy, and solution-focused tools gain power when paired with cultural humility. Affirmation is not indulgence, it's oxygen. Culture isn't the enemy, it's the terrain. Here's a case example for Jordan. Let's start with a vignette I wrote. This evening was a quiet one. The flickering of a candle in the dining room illuminated the cross that was ever so present on the wall. Father Stephen sat with his Bible open, his pen against his mouth as he struggled to finish his sermon. He was supposed to be exploring Romans 15, verse 7 that Sunday with his congregation. Romans 15, verse 7 tells believers to accept and support one another, just as Jesus accepted them, so that they can build a loving Christian community. Stephen sat there in silence. The whole town had gone quiet already. The farmers had put away their equipment, and the livestock had fallen asleep. The grandfather clock on the wall echoed down the hall, now that it chimed midnight. Upstairs, he heard his wife sobbing quietly, as she had been doing for many days since the incident. The air seemed heavy this week, and it was especially gloomy. For Stephen's conservative town, all was going so well. They had just elected another conservative mayor, and the whole town as a whole, and the whole country as a whole, was becoming more vocal in its conservative attitudes. He looked down at his hands, his pen against the page as he struggled to write. These same hands had baptized his daughter, instilled many values about womanhood and about Bible verses which highlighted how God created her in his image. Stephen pondered what went wrong. God doesn't make mistakes, he whispered, but the words left a sick taste in his mouth. He was uncertain, like a prayer he no longer understood. This vignette sets us up for Jordan. Jordan is a 15-year-old transgender boy living in rural Michigan. He presents to counseling with school avoidance, bullying, and family pressure to fix the confusion. He enters unsure whether the space is safe. The first task is establishing psychological and physical safety. We clarify confidentiality, assess for risk, and invite Jordan to share what helps him feel like himself. Trust becomes the intervention. Jordan's symptoms, anxiety, depression, hypervigilance, reflect chronic invalidation trauma, not identity confusion. Diagnosis must reflect context rather than community bias. We build a scaffold of safety using CBT for shame, narrative reframing for resilience, mindfulness for grounding, and acceptance and commitment therapy for values-based identity strength. Direct family engagement and ethical challenges. Direct confrontation fails in resilient or resistant families. Instead, we use value-based reframes, gradual exposure to affirming language, and introduce parent peer groups to normalize understanding. The goal Move the family from fear to curiosity to cautious support, up to total acceptance. That is the main goal. Over time, Jordan shows reduced anxiety, improved school re-engagement, and increased trust in the counseling process. This case demonstrates how affirmation, cultural humility, and consistency can transform outcomes for rural transgender youth. Switching tones. Here's a resource list for local, regional, and telehealth options. These are the key sources informing today's workshop and presentation. They include the ACA Code of Ethics, the WPATH Standards of Care, APA guidelines, and current research from the Trevor Project, SAMHSA, and recent clinical studies. Thank you for being a part of this training. Affirming work in rural spaces is challenging, courageous, and deeply meaningful. The presence of even one safe adult can change and often save a young person's life. Next, we'll go into the reflections and the workshops and the role play. Thank you.